I'm finding it increasingly difficult to have discussions about particular COVID-19 restrictions, rules, and mandates here in Canada. Whether just chatting with people or via correspondence, going on the talk radio programs I go on, there's a whole bunch of things that we can discuss. The mask mandates, the trucker vaccine mandate, very controversial, different rules that are out there. And I find it difficult because I'm no longer really interested in getting lost in the weeds on all of these particular issues. Because when you stand back and look at the big picture, it's kind of clear right now that they all have to go. All of the broad-based rules, all of the rigid, overbearing restrictions. Maybe people are going to choose to wear masks when the mask mandate ends. In jurisdictions where there are no mask mandates, a lot of people choose to wear masks. That's fine. But increasingly, we're moving towards a direction where jurisdictions all across the world are dropping all of their COVID-19 rigid rules. People are doing personal choice. They are choosing to still follow certain precautions, but the rules are dropping away. You're still allowed to wear a mask in these places. Of course, it's not illegal to wear a mask, but it's no longer legal to not wear a mask. And here's the thing. This perspective that we've got to do away with pretty much all of these rules, that is increasingly becoming the mainstream position. It is the mainstream position. Prominent public health officials have basically been saying this. Dr. Bonnie Henry saying the other day, we now have to treat COVID-19 like we would influenza or other seasonal viruses. Dr. Kieran Moore, Ontario's chief medical officer, saying, we got to learn to live with this, saying we've had 2 years of fear that have led to sometimes excessive rules that maybe we didn't need. These are the chief medical officers saying these very things. Now, part of the challenge, and I've heard people's frustrations in reaction to what these medical officers have said, it's not like they said these things and then immediately got rid of all of the rules. Dr. Bonnie Henry said that, and yet vaccine passport is still in place. People are very frustrated with that. I think part of what's going on right now is public health officials are now kind of working to walk people back a bit, to de-radicalize them. Because we know in parts of Canada, particularly where I am at in Ontario, we have such a regressive, restrictive response compared to so many other jurisdictions. It is just flat out embarrassing, but people are deeply fixated on it. I mean, I think for some people, the idea of the mask mandate ending, they're going to have a problem dealing with that. And I kind of feel for them because the trauma for some people is very real, but that's no excuse to not do it. We have to do it. We have to proceed. We have to move forward. So it's interesting to see where the conversation is at right now. And as I said at the beginning, when someone wants to talk about the particulars of the trucker vaccine mandate and the percentage of truckers that are and aren't vaccinated, and maybe we can revise this rule and maybe revise that rule, okay, fine. I guess we can talk about the particulars and tweak this and tweak that, or we can just do what so many other jurisdictions are doing and do away with the whole thing entirely.